Hey mama, if you've ever stood up, rolled over, or made a quick movement in pregnancy and had a sudden pulling pain in your lower abdomen, then you are not alone and you are in the right place. In today's video, I'm going to guide you through 5 prenatal exercises for round ligament pain in pregnancy. They are designed to help relieve the discomfort, release the tension, and help support your changing body. Hi, I'm Dr. Anna Town, pelvic floor physical therapist, pre- and postnatal exercise specialist, and mom of almost 4. I'll be walking you through what's actually happening in your body and why round ligament pain happens and how to safely manage it from home. Before we get started, make sure you subscribe for more pelvic floor PT designed pregnancy safe exercises to help you feel supported, strong, and confident in every season of pregnancy. Let's start with what's actually happening. Your round ligaments are bands of tissue that help support your growing uterus. As your body changes during pregnancy, these ligaments stretch to make room for your growing baby. Because of this stretching, these ligaments can cause a sharp, quick pulling sensation, especially when those ligaments are suddenly engaged. Some of the most common triggers include standing up too quickly, rolling over in bed, sneezing and coughing, or sudden jerky movements. If you felt this before, the pain can catch you off guard and even feel a little scary. But in most cases, this pain is completely normal and very common. The good news is that there are simple and gentle ways to reduce the discomfort and support your changing body in pregnancy. We're gonna go ahead and start in a half kneeling position. So one knee is up, right knee is up, the left leg is behind you. The important thing to start with here is actually doing a little bit of a posterior pelvic tilt. So you're gonna tuck your pelvis underneath you. In pregnancy, our position tends to tilt forward, so we want to tuck that pelvis underneath you slightly. From that tucked position, you're going to slightly shift your hips forward. Most common mistake I see with this one is going too far forward. Again, then our pelvis is shifted too far forward. We don't want that, okay? A little bit of a tuck, a little bit of a shift forward. In that position, you should already feel lengthening in the front of your left hip. Then we're gonna take our left arm and we're gonna reach across our body, across midline. So inhale through your nose. As you exhale, reach gently forward into a deeper hip flexor stretch and then reach cross body into a good stretch into your left rib cage. Let's do a couple more breaths here. Inhale through your nose. Exhale. Reach slowly, gently into that side body. So reaching to our right, stretching into our left. Inhale through your nose. Exhale. Also, again, opening up the front of that left hip. One more breath. Exhale. All right, let's go ahead and slowly and safely bring it out of that stretch. You should feel lengthened in the front of the body, lengthened in the side of the body. Let's go into our next exercise. You're going to prop onto your right hand and bring right leg in front of you, left leg behind you, both knees bent. You're going to focus on stretching your side body. So on inhale, breathing in through your nose. On exhale, you're reaching your left hand forward as you stretch your right chest wall down to the mat. Inhale through your nose. Exhale through your mouth. As you exhale, you're gonna let your right elbow bend as again, your right rib cage comes closer to the mat. We're gonna keep getting a little bit lower here. Inhale through your nose. Exhale. That stretch should intensify. Common mistake I see here is that we let that shoulder come up towards the ear. Keep that shoulder pushing away from your ear so we keep your neck out of the equation. Inhale, exhale, Again, keep reaching and lengthening. You should get a really good side body stretch here. One more deep breath. Inhale and exhale. You should also feel your side abs working on the left and maybe a little triceps on that right side. All right, go ahead and slowly come on up. You should feel really elongated on the right, and again, left abs working. For this exercise, you'll either need a foam block or a small ball to go in between your knees. Go ahead and lay down on your left side, and you're gonna prop your head on your elbow, and then you're going to reach your right elbow forward in front of you. You're going to inhale through your nose as you reach your right elbow up towards the ceiling, and then back behind you as much as you can open up. You're gonna hold there and you're gonna breathe. You wanna keep your hips squared, and again, just a gentle squeeze of that ball so your pelvis is staying in a neutral position. Then slowly come on back. So elbows are both pointing forward, and then inhale through your nose, open back up, and then exhale. As you hold that stretch, and try and lengthen that right side body as much as you can. This is a great mobility exercise for your thoracic spine or your mid spine, as well as your chest. Inhale, bring on back, and then let's bring in one more. Hopefully each time you roll back into that rotation, you're able to get a little bit deeper, a little bit further down with that elbow towards the wall. And if you want a deeper stretch, you can also extend that arm all the way behind you. I have a wall behind me, so I can't go super far, but you can straighten that arm completely to intensify the stretch. All right, one more here. Again, modify this stretch. If it's feeling too intense, bring it back to bent elbow and don't go quite as far back. You're doing a great job. Choose a level that is most appropriate for you right now. And then slowly bring it on back. For this stretch, I'm going to have you use a large ball or something like an ottoman. You're going to lay on it with your left side down, and you're going to be up against a wall so that we're not rolling around and injuring ourselves. So you're going to extend out your right leg, and then we're going to reach our right arm over the ball. So our left armpit is on that ball, our left side abs are on the ball, and then we're reaching and lengthening our right side body. So inhale through your nose, reaching across, and then exhale through your mouth. Each time you're exhaling, try and lengthen a little bit further over that ball. Inhale. As you inhale, try and breathe into your right rib cage, the rib cage pointing up towards the ceiling. Inhale and exhale. Couple more deep breaths here. Left ab wall should be contracted over that ball. Inhale and exhale. If this stretch feels too intense, you can always come out of it and not go as deep or as aggressive. You modify as you need to here. Inhale through your nose and exhale. Last breath. You got this, mama. Exhale. We should feel really lengthened on that side. Go ahead and slowly and safely come on up off of that ball. Go ahead and grab a small ball here, and we're going to go into a hands and knees position with the ball in between your knees. You're going to round your back up towards the ceiling and tuck your pelvis underneath you. I want to make sure that we are not doing cat-cow here, okay? That's not our exercise, so if that's what you're trying to do, please listen to my cues. Instead, what we're going to do, round the back, tuck the pelvis underneath you. We're going to inhale through your nose. As you inhale, let your belly relax and breathe into your back and your side rib cage. And then on exhale, pull the belly up towards your spine, engaging your deep low core. Then inhale through your nose Let belly relax. Exhale. Engage that deep core. So when I say let belly relax, again, make sure you're not tilting or rocking that pelvis forward. We want to keep that pelvis in neutral, if not slightly tucked underneath us. Inhale through your nose. Let belly relax. Let it sink down towards the floor. And then exhale. Lift that belly up off of the floor and pull those hip bones together. Couple more here. Inhale through your nose. And exhale through your mouth. One more. Inhale. And exhale. Great. You should feel that deep core working, active, and contracted. And that is our 5 exercises for round ligament pain in pregnancy. If you're looking for more guided week-by-week support, inside our Strong Expecting Mama program, we walk you through exactly how to care for your body in pregnancy while preparing for delivery and for postpartum recovery. Click the link below to get instant access to your free 3-day trial and start exploring Strong Expecting Mama today. If this video helped you, don't forget to subscribe for more pregnancy-safe guidance. And don't forget to share this with a mama who might need a little extra support right now. See you next time.